Hi everyone, welcome to another episode of Whole Meds powered by R.A. Williams. I'm your host Kimberly. Today we have the distinct pleasure of holding a meds with the Minister of Health and Wellness, Dr. the Honorable Christopher Tufton. Hello, Dr. Tufton.
How are you? How are you?
I'm Livish. How are you?
Good, thanks.
I want to start by saying that you and your team have been doing a great job, really putting in a hard work to address a lot of the pain points in the healthcare industry. Kudos to you. But of course, the journey continues. There's still a ways to go. And in terms of access to pharmaceuticals, what would you say are some of the challenges Jamaicans are facing?
Right, so over 1 million Jamaicans benefit from pharmaceuticals through the government, and then of course the rest through the private space. The challenge in the public sector would be issues around particular brands being requested. Of the 22 sickness categories that we have, which we have increased by a number of them since I became minister. We have a VEN list that's just about 1,000 types of drugs, and while we have multiple drugs for a particular illness, sometimes patients ask for a specific brand based on what the doctor orders and so on. So that could be one. The other would be logistics. Even though we have public-private arrangements through the drug-serve windows, you may have in one place and not have in another. And sometimes people don't follow up by contacting the NHF. So the logistics management sometimes is a challenge. But generally speaking, I think the NHF, which is the primary agency for drug distribution, has done a very good job. And people are generally satisfied that the government has created an opportunity for them to access drugs. So while we're always a work in progress, we think that we've done a fairly good job.
I agree totally, and I'm happy you mentioned that because in our last episode we had Everton Anderson, CEO of the NHF, who spoke to us about a lot of the milestones that they've been able to tick off in the last 20 years, and key being the 22. The number has grown from 17 to 22 in terms of the coverage, the drug disease categories that they now cover. But you also mentioned logistical challenges. How is the government working to address those?
Well, we've started. It's a lot easier now to access drugs through the NHF because of the public-private partnerships. I think we have close to 50 or just over 50 private pharmacies that have a drug-serve window. It wasn't the case prior to now, to the new administration. And then the NHF has taken over the pharmacies in all our hospitals, our public health system and health centers. So they now administer all of those. And they have generally been more efficient.
Yes.
From a number of perspectives, they have a better inventory management system. They have a database which allows them to provide topping up of drugs once they see a certain level being reached. And the pharmacies tend to be trained in a particular approach, and they have more staff and so on. So from that standpoint, I think that we have done a lot to cover that. But again, it's a process, so from time to time you're going to have issues that you have to confront and deal with.
How do pharmaceutical distributors like R.A. Williams impact the local healthcare industry?
Well, my approach as a lead policymaker in health is that we have to view healthcare as one health.
Yes.
Not as public versus private. So one of the things that we've tried to do is to ensure that that one health concept satisfies the needs in the market space. I have a lot of respect for the private distributors, the private pharmacies, because they provide a lot of services that otherwise we would have to provide, which means additional strain and challenges and resources. Beyond that, the basis on which we can do public-private partnerships, which we do now, drug serve windows being one, we do it in diagnostics, we do it in several other areas, is very important because you're really catering to a market that more often than not crisscrosses between private and public. They have a private doctor, but they may end up in a public hospital type of thing.
Yes.
And the extent to which we can merge quality assurance, it helps in terms of offering us a kind of consistent response. And that's what, companies like yours do.
Yeah. Well, that brings me to my next question. Since you mentioned quality assurance, the vast majority of our pharmaceuticals are imported. What assurances do Jamaicans have that they are safe, effective, and of high quality?
So I tell you, we have a very detailed, for want of a better word, process of determining what drugs are allowed in the country through the Standards and Regulations branch of the Ministry of Health and Wellness. So you have to apply, and then you have to provide evidence through clinical trials and otherwise case write-ups as to the authenticity of the drug. And that can take a while. I mean, a lot of pharmaceutical distributors complain that it takes too long, which we're doing some things to try and correct. But what people need to understand is that it's done in the first instance to ensure the safety of the consumer, and that when those drugs are sanctioned, one can rest assured that if it's prescribed for a purpose, it helps that cause. So that standards agency is the chief regulator, and they not only approve, but they do surveillance.
Right.
So to the extent that drugs are here without permission or validation, they can investigate, and they have powers to detain and to seize and so on. So that is our primary agency. Beyond that, though, you have the agencies like the Council on Drug Abuse, which is a part of the ministry, and they do periodic inspections also to look at what is out there. You may recall recently where some kids in St. Anne had bought a snack that contained THC, I think, extract from marijuana. So the Council on Drug Abuse would go out, do the inspection, do the investigation, and they coordinate with the standards agency.
Okay. So Jamaicans can then rest assured that we have a robust and rigorous...
Yeah, what needs to happen though is that, yes, but also a critical part of surveillance is the concept of being aware.
Yes.
So people need to question the concoctions that are put before them.
So your own personal accountability.
Yeah, so you have to take responsibility for that, and that is very important. So we do encourage that also.
Agree, totally. Well, that brings me to my last question. What's your vision for Jamaica's healthcare industry?
The first one is that persons realize that healthcare is very holistic. Unfortunately, we have narrowly defined health as hospitals and health centers and doctors and nurses. And that's probably when the horse has gone through the gate. Health is wellness, which is why we changed the name. So it's about the body, the mind, the soul. There are many facets to it. And if you want to enjoy quality of life, you have to cater to all the facets. And so one of the reasons why we redefined health and why we expose things like Jamaica Moves and Better For You menu and nutrition policy and those things is to create an aware consumer that sees personal responsibility as a very important way. So my vision is that people will see health in a much broader term, which we have tried to do. Secondly, that they will take action, because health is more behavioral than it is clinical. I don't know if you understand. So the problem that plagues us now is around NCDs, lifestyle illnesses.
Yes.
You don't cure lifestyle illnesses by taking medication. You cure it by your behavioral change.
Right.
So you do more exercise, rest, that kind of thing.
So lifestyle changes.
So lifestyle. So I've tried as a social scientist, I'm not a clinical scientist. I've tried to introduce behavioral sciences in health. And we're at a stage now where we're kind of embedding it.
Yes.
So for example, we're hiring an executive chef in the Ministry of Health to help people to see the virtues of eating healthy.
Start
and
in the
what
kitchen.
nutrition. Yeah, exactly, which is unusual. So my vision is to see health integrated in a much more broader scope. And so when people it's also to improve our facilities. So we're building out hospitals, adding more doctors and nurses. But there's a lot of it that depends on community intervention at the primary level, where we focus on prevention. And we've done a fair bit of it, but there's so much more to do, because we have to get the mindset change around that concept.
I love that. I love that. Health is beyond the clinical.
Yeah, it's more behavioral.
Starting with people. Thank you so much, Dr. Tufton. It was a pleasure.
Always my pleasure to advance the process and the discussion. Thank you.
We hope to have you again soon.
All right.
Thank you guys so much. There you have it. And we hope this was insightful for you. And until next time, go and hold our meds.